All right. Well, good morning, everybody. My name's Herbert, and I'm doing this because I want to share my story as far as you know um, my my pain journey. You know, I'm 47 years old, turning 48 this year. I want to start off by saying that I have a left hip replacement already, and I'm 41, I believe, about 6 years ago, maybe 42. 5 or 6 years ago, right? Which is relatively young compared to the average age. Um, Most people get it at around 60, 65, maybe 70, depending, right? Basically, I've done a lot of sports. I've been in sports all my life. I did a lot of heavy weightlifting, CrossFit as well. Did karate for about 3, 4 years, ground and pound, some MMA stuff. Um, you know, all that kind of took a toll. Sprinting, jogging. I love to jog. Um, but I think the catalyst to all this was when I was a teenager. I had a lot of acne, and I took the medication Pro Accutane, and of course, when you're a teenager, you don't want to have acne. So I remember approaching my doctor, and after prescribing certain doses, one a day. I told him, Doc's not working. I still have acne. So he upped it to 2 pills a day. I don't remember the exact amount of milligrams. So it started to work. Then after 3 months, 4 months, he said, I need to take you off. It would dry you up. It's one of the symptoms. Of course, it dries you up. I would have to wear lip gloss and put eye drops, and just dries you up. But with it, it dries the acne. And but I was like, no, as a teenager, you don't want to have acne on your face. I think only the people that have acne on their face understand. Kids can be cruel, teenagers can be cruel, and that's the only thing you got when you're a teenager is your face. So you don't want to have acne. And he warned me, later in life, your joints, it dries you up, you're gonna feel it. And here I am at 47, really feeling it. So what's going on with me? And right now, as a matter of fact, in an hour and a half, I'm gonna go talk to my orthopedic surgeon that did my left hip. We're gonna go talk about my right hip, which it's been talking to me for a year and a half. Manageable. Um, I stretch every day, which we'll get into that in another video. What I do and how long I've been doing that for, but that's been essential. I also have. I'm gonna make an appointment for an MRI. Um, my cervical. I get tingling, kind of a sprinkle of tingling on my left arm. Um, Not constant numbness, but occasional numbness, right? Slight numbness. But mind you, I do stretch again every day, so I don't know if that's delayed it. So I'm scheduled for an MRI next month. I've had an MRI in my lower back. I scheduled finally. I had made an appointment to with an orthopedic doctor, but he said go get an MRI, which I did. It showed up as degeneration to my lumbars on my left side and a herniated disc, and that's just on my lumbars. I'm sure up my thoracic. The lumbars are the lower part of your back. So on the thoracic, that means on the middle part of your back. I'm sure there's more. I have pain there, so but we'll worry about that later. I've been tolerating that for I could say decades. You could say. So I have a appointment with a pain management doctor, see what he can do with the lumbars. Of course, you always want to opt for surgery. That's the last option. You don't want to, especially on your back. Hip, I think that's one of the easiest recoveries and not as painful. So that one, I did my own rehab in my own place. I was back at work in about a month and 3 weeks after my first left hip replacement. So we'll get into that later. But my whole purpose of doing this is for those people that are going through arthritis, that have those symptoms, that know the joint pain of, especially if you're not retired, if you have it, it's a constant battle. There's good days or not so good days. There's really bad days. So um, I deal with it by, of course, I do stretch every day, which we'll get into that. I do take medication. I don't like taking pills, so but every once in a while I do have to take a series, like sometimes 3 days, 4 days, a week. That'll help me tone it down. I do take a tea every day, a natural remedy, with ginger and turmeric. That helps with inflammation of the joints. I'll get into that later as well. So all those, constant, um, I guess, you know, uh, pain modalities, you could say, the stretching and, teas that help me to cope and deal. But I constantly live with pain, and when I go to work, I'm a physical therapist assistant, so the bending down, the lifting, the walking, all that, it's pros and cons because you stay in motion helps you, but walking, grinds, put weights on the joints, the bending down, sometimes I'll feel my sacrum, which is that triangle part of your lower back. Sometimes I feel it throbbing, and I have to ice it down when I get home, or sometimes at work. So there's constant pain all the time, and I've dealt with this for for a long, long time, years, so decades. I first started getting the symptom of my left hip when I was 36, I believe, 36, 37. This excruciating pain that woke me up in the middle of the night. Mind you, I was working out a lot, running and lifting and crossfitting, all this stuff, But you're 37, you still think you're young enough. You're like, oh my God, it's just, workout pain. But the pain was so severe that night that it woke me up, and the next day I couldn't even put weight on my leg. But I just thought it was, workout pain. I was in denial. I don't want to deny. I'm too young to be going through, growing pains or joint pain. So, anyways, you keep pushing through, and eventually it caught up with me when I was 40, and I stopped working out. I couldn't. It just hurt. Couldn't sprint. Couldn't run. Gained some weight. Kind of went through a depression mode. I'll get into that in another video. But yeah, that's basically my story. So I want, for those of you that are going through that, I'm going to help you out with my routine, show you what I do to cope, stuff that I take when the weather changes, how to deal with that, and when to take the day off and when to listen to the body, right? Um, so, and I guess today is day one where I'm gonna start to walk everybody through my journey, and hopefully, if you guys interact and send me questions, I'll answer them to the best of my ability, what works for me, So, and keep in mind, I'm not a doctor; I'm a physical therapist assistant. So, but I've been around this all my life. I work with patients with hip replacements, knee replacements, spinal fusions, cervical fusions. That's the neck. And of course, I myself have been a patient of this, except, the only surgery I've had is the left. But, so hopefully I can help people out. Um, I think it's time, that very selfish of me for me to not help people, um, and help people as much as I can walking you through this journey. So again, once again, my name's Herbert. I'm 47 years old. I have degeneration of my joints. I don't want to say the word arthritis, right? I don't want to claim it, but just to put it in perspective, I'm 47 years old. I have a left hip replacement, which I got about 5, 6 years ago, and I'm gonna go talk to my orthopedic surgeon right now, explore the dates, and the financial aspect of it for my right hip. All right. Okay. Well, thank you guys for your time, and we'll do another video. Hopefully you'll like, and I'll see you then.